Oop, a little low. My name's Claudine Lewis. I'm a respiratory therapy student, and I'm going to go over some mechanical ventilation with y'all. Right now I'm in standby mode. Let's go with a new patient. Ideal body weight of 75. Change their weight to 55. Accept. So if you don't push that button while that's yellow, it will go to the previous setting. So we have a new patient. We have adults. I'm going to standby. I'm going to go to vent settings. O2 is 50%. Tidal volume is 380. Inspiratory time is 1.1. This is on SIMV mode. Let's go to pressure support. Doesn't really change anything. PEEP and pressure support are both set at 5. Mandatory minute ventilation. CPAP pressure support. Just set at 5. SIMV again. Okay. Tidal volume is 380. Where's pressure support plus? Where are you at? There you are. Sorry, pressure control plus. We're going to start there. So I've already got my settings in here for my patient, which I'm going to have that all set up before I start ventilating my patient. I've got my alarm settings here. High minute ventilation is 10, low is around 3. Airway pressure is 40. Respiratory rate is 35. Apnea is 20. High tidal volume is 750. So we're gonna vent settings. We're gonna go PCB. We're gonna start it because it turned yellow. All right. Maybe we're not. Just kidding. Oh, shit. There we go. There we go. That's not the mode I want to be in personally. Let's go to SIMV. There we go. SIMV. Yes, I know. Okay. And it's going to beep at me a lot. I always do. So I have my test line here. I have my this represents my patient. So this is their ET tube. Here's their suction. Let's say I wanted to give them a nebulizer. There's 2 options for that. One is to do it the old-fashioned way by hooking it up to an O2 flow meter. The other option with this dragger is to have my T-piece. Well, the T-piece would be needed for both. So we have our T-piece. We have a nebulizer in here. We have a little port like right next to the exhalation. Kind of between the two. It's just a little metal thing sticking out. It's perfect. Click nebulizer, push the button, and you can hear it. And it only does it on Inspire, and it does it, it takes about 15-20 minutes to do that. That way I don't have to worry about the extra flow I'm giving to my circuit. Another option for medication delivery, please stop, would be to do an MDI. So we have our spacer here. So we would pull that apart. We have a little teeny tiny port. Where are you? There it is. Back here for just the canister out of the MDI. It won't do any other inhalers. They do not use them here. They always do aerosol for vent patients. So we would take our inhaler, we would shake it, we would warm it, we would pull the canister out, we would hook it up to our port, we would push it, and we would do an inspiratory hold. We'll let go, shake it, warm it, do it again, do our inspiratory hold. Fantastic. We would want to remember to put our little thing back together so that we don't have that extra little bit of circuit to overcome. And it snaps. There we go. There's the snap. Yes, I know. Go. All right, so we've covered suction. We've covered the MDI. Actually, I don't know that I covered suction in this particular video. So we'll cover it again. Let's say after giving the breathing treatment, they've got some excess secretions that need to come out. We're going to show this to them. I would have gloves on. And then the patient will cough just like any other time. It's kind of helpful to hold your breath for a second. Because as long as you're going without a breath, so are they. It's a good rule of thumb. So let's say I wanted to lavage. I have these little pink saline things. They're sterile. I can squirt it, take this cap off, and squirt it down in there. I'm not going to do that because there's the testing attached. And I can do that to clean the port. I can also suction some excess secretions out of there because there's always, for some reason, a whole bunch of fluid right in this part of the circuit. I don't know why. So that's how you suction. And then let's say after I do all of that, I want to do some mouth care and check my cuff pressure. This is just part of your daily, shiftly, several hourly vent check. Mostly the nurses here do we do the cuff pressures, but they do the oral cares. So here I have my patient. This is a child tube, so it is not cuffed. But if I were going to check it, I would have a manometer. And I would just put it on the end of the cuff, just not the cuff, but the little fill valve thingy, the bulb, I guess, and just long enough for my needle to change and hopefully read right around between 20 and 30. It'll be green from all the manometers we have here. So, okay, I'm kind of in the middle. So every so often you also want to change the positioning of your ET tube because the holder and everything will create some pressure sores. So I have my ET tube. 2 minutes is not long enough. So I have my little oral care kit, and it would be attached to suction. So since we're kind of in the middle, I'm going to hold my tube. I would have gloves on, of course. I'm going to clean. I always go from the back towards the front, from the back towards the front. Kind of want to watch what I'm doing. Make sure I don't do anything weird, like kink the tube, back to front, and you would get a different swab each time. So the tube is in this little holder. I want to verify that the markings are where they were prior to when I started. And now that I'm done, also I want to change its position. They do this every time they check their vents here. So I would go, I'm going to try to make it stay over here. So we're going to say that it's over here on the patient's left. And I would document that. And I think that covers everything. Thank you.